One, when developing educational materials for nurse practitioner certification preparation, which instructional design principle most effectively supports adult learners. A, emphasizing memorization through repetitive drills. B, integrating real-world case scenarios relevant to clinical practice. C, limiting content to theoretical frameworks. D, providing minimal feedback to encourage self-reliance. 2, a nurse educator designing a review program for the AANPCB exam should prioritize which evaluation strategy to measure learner competency. A, peer review feedback only. B, summative assessment using scenario-based MCQs. C, oral questioning after each topic. D, written reflections without scoring criteria. 3, in mentoring NP candidates for certification, which approach best enhances self-directed learning? A, assigning reading lists without discussion. B, encouraging goal setting and reflective practice. C, delivering lectures on exam content only. D, providing step-by-step instructions without autonomy. 4, which of the following demonstrates compliance with AANPCB's regulatory standards for test integrity? A, sharing past test items among students. B, discussing confidential exam content. C, maintaining confidentiality and avoiding test disclosure. D, replicating test content for classroom practice. 5, when designing formative assessments in NP review programs, what is the most important consideration? A, aligning items with adult learning styles. Ensuring assessments are unpredictable. C, focusing on subjective grading. D, avoiding clinical context. 6, a nurse educator evaluating test outcomes notices consistent low scores in pharmacology questions. The best initial action is to A, add more pharmacology lectures. B, conduct an item analysis to identify knowledge gaps. C, decrease question difficulty. D, ignore the results and continue current teaching methods. 7, in curriculum development for NP certification, which component should be addressed first? A, instructional delivery. B, learning outcomes and objectives. C, assessment criteria. D, teaching materials. 8, effective feedback for AANPCB test candidates should be A, judgmental and directive. B, timely, specific, and focused on performance improvement. C, delayed until course completion. D, limited to overall grades. 9, a test item that consistently results in high failure rates among competent students likely indicates A, high content validity. B, poor item construction or ambiguity. C, excellent question difficulty. D, strong alignment with objectives. 10, in adult learning theory, readiness to learn is best enhanced by A, imposing strict schedules. B, linking content to professional goals. C, assigning tasks without context. D, using rote memorization. 11, when evaluating NP certification readiness, the most reliable measure of performance is A, peer comparison. B, criterion reference testing. C, instructor opinion. D, self-assessment only. The role of mentoring in preparing for the AANPCB exam primarily involves A, delivering content-based instruction only. B, supporting confidence, reflection, and test strategies. C, limiting learner autonomy. D, reducing practice test exposure. 13, which component ensures regulatory compliance in a certification review course? A, confidential handling of test-related materials. B, public sharing of test blueprints. C, modifying standardized exam questions. D, encouraging unauthorized study groups. 14, to ensure fairness in evaluation, nurse educators must A, use validated standardized assessment tools. B, create different exams for each learner. C, allow unrestricted collaboration. D, apply inconsistent scoring methods. 15, which communication technique best supports adult learners' motivation in test preparation? A, monologic instruction. B. Dialogue that values learners' prior experience. C. Frequent interruptions to correct errors. D. Avoiding learner feedback. 16. The most ethical response to a student requesting confidential test items is to A. Provide similar versions for practice. B. Share them privately. C. Redirect the student to legitimate study resources. D. Ignore the request. 17. An effective mentoring session for NP exam readiness includes A. Setting measurable goals and reviewing progress. B. Focusing only on weaknesses. C. Delivering prescriptive directions without discussion. D. Avoiding time limits. 18. Which best describes a summative evaluation in NP education? A. Mid-course check-ins. B. End-of-course competency testing. C. Informal feedback sessions. Daily self-reflections. 19. When developing test questions for AANPCB review, item difficulty should be A. Uniform across all items. B. Balanced to differentiate high and low performers. C. Randomly assigned. D. Avoided to reduce stress. 20. In assessing learner performance, which type of validity ensures the test measures intended outcomes? Content validity. B. Face validity. C. Predictive validity. D. Construct reliability. 21. Which method promotes deeper learning among adult NP candidates? A. Problem-based learning using clinical cases. B. Memorization of drug names. C. Passive lecture attendance. D. Minimal learner interaction. 22. When teaching pharmacology for certification review, best practice includes A. Relating drug mechanisms to clinical decision-making. B. Listing all available medications. C. Excluding contraindications. D. Focusing on brand names only. 23. Ethical practice and evaluation requires that educators A. Disclose test scores publicly. B. Use results confidentially and constructively. C. Rank students competitively. D. Ignore informed consent. A high-quality NP review curriculum should primarily focus on integration of clinical reasoning and evidence-based practice, memorization of isolated facts. C. Theoretical knowledge only. Simplified recall tasks. Effective adult learning is best achieved when A. Learners see immediate relevance to their practice. B. Content is abstract. C. The instructor controls all discussions. D. Objectives are unclear. 26. AANPCB's recertification standards emphasize A. Continuing education and clinical competency maintenance. B. Retaking the full certification exam annually. C. Reducing clinical hours. D. Ignoring practice updates. 27. The most valid way to determine the effectiveness of a review course is A. Learner satisfaction surveys. B. Comparison of pre- and post-test scores. C. Instructor opinion. D. Attendance records. When creating MCQs for AANPCB practice, each item should A. Assess higher-order thinking aligned with the test blueprint. B. Use complex wording. C. Be unrelated to clinical scenarios. D. Include only factual recall. 29. Which evaluation method provides the most objective measurement? A. Structured multiple-choice testing. B. Group discussions. Oral questioning. D. Peer reviews. 30. Reflective journaling supports certification success by A. Encouraging critical self-analysis and growth. B. Serving as a substitute for studying. C. Recording lecture notes. D. Listing facts for memorization. 31. During mentoring, the best method to promote accountability is A. Regular goal review and self-assessment. B. Random progress checks. C. Assigning tasks without deadlines. D. Avoiding performance feedback. 32. In developing a learning module, alignment refers to A. Matching objectives, instruction, and assessment. B. Separating theory from practice. C. Prioritizing random content. D. Excluding learner outcomes. 33. Nurse practitioners preparing for certification often benefit most from A. Simulation-based clinical scenarios. Memorizing textbook chapters. C. Avoiding practice questions. D. Listening-only lectures. 34. An educator ensures test reliability when A. Results are consistent across repeated administrations. B. Questions vary unpredictably. C. Scoring is subjective. D. Feedback is infrequent. 35. The principle of adult learning known as andragogy emphasizes A. Learner autonomy and experience-based learning. B. Dependent learning. C. Teacher-centered instruction. D. Passive knowledge reception. 36. Which communication barrier most hinders effective mentoring? A. Lack of active listening. B. Open-ended questioning. Clarification requests. Empathic dialogue. 37. To support regulatory compliance in educational settings, nurse educators must A. Follow FERPA and HIPAA privacy standards. B. Publish all student data. C. Allow sharing of confidential information. D. Disregard data protection policies. 38. The main purpose of formative assessment in AANPCB preparation is to A. Guide ongoing learning and improvement. B. Certify final competency. Rank learners. Replace summative exams. 39. When developing rubrics for test evaluation, educators should ensure A. Clear, measurable criteria aligned with objectives. B. Vague descriptors. C. Subjective scoring. Inconsistent scales. 40. A nurse practitioner demonstrating reflective competence after exam feedback is A. Integrating lessons into future clinical decisions. B. Ignoring performance results. C. Memorizing all incorrect answers. D. Avoiding further evaluation.